Hello, I'm Dr. Frank Drummond, National Medical Director for Behavioral Health Service Line with HCA Healthcare. And we're here today to talk about youth suicide in 2021. I have the great pleasure of being joined by Clark Flatt. Clark is a nationally recognized speaker on the topic of youth suicide awareness and prevention. With over 20 years in the field of suicide prevention, Mr. Flatt is president of the Jason Foundation, leads one of the nation's oldest and largest nonprofits whose mission is addressing the national health crisis of youth suicide. Welcome, Clark. Thank you for joining me.
Well, Dr. Drummond, thank you for having me, and we're looking forward to this conversation.
We have been working together for 3 years. And of course, you've been working with HCA longer than that. That's kind of coincides with when I started. But I really had the great pleasure of seeing this program, I want to say explode, but I'll say grow exponentially. And what that means is the number of lives that have been touched, both by teachers and students, has really gotten substantial. Do you want to spend a minute to go over the Jason Foundation and sort of the basic tenets of what it does?
Very quickly. We were formed in October of 1997. Regretfully, after the tragic suicide death of my youngest son, Jason, who was age 16, that happened on July the 16th, 1997. It was after losing Jason that we found out that as a parent, I'd went to every PTO, PTA that had anything to do with raising my two boys and keeping them safe. Talked about drugs and alcohol, even a form of bullying back then. But no one had ever discussed suicide and its impact on families and young people, despite the fact it was the third leading cause of death then at that time. So we started the Jason Foundation simply with the idea to help provide parents with information, not to scare them, but how to recognize suicidal ideation and how to respond to it. We've been very blessed and have grown because of great partners like with HCA, that we're able to get out there. The real, I think, effort of the Jason Foundation is what we call local folks helping local folks, to be able to work through those hospitals throughout the country and providing the information on a local basis. So we still do all of that. Like I say, our number one program is teacher trainings, but we do a lot of parents and youth also.
And the teacher training is recognition, intervention, and education.
Yeah, we don't make them counselors. We stress that very much. Our training is not to make you a counselor. In fact, we say it probably too much at the beginning of each one of our training modules. It's to help you be able to better recognize when a student might be struggling with thoughts of suicide, or as one of the greatest fears of a teacher, when a student comes up to you and says, I want to talk to you, and they're saying, gee, I'm really having some bad thoughts. For a teacher to be able to be prepared to know how to respond to that appropriately, what their school's protocol is, and be able to access that rapidly. That's very important. And I think that's probably the number one thing that a community can do if they're not doing it already, to make sure their educators are trained. We do more than any other nonprofit in the nation. We train close to 200,000 a year. I just checked our numbers before we started this one. We've actually trained about 2.8% of all the teachers in the nation up to this date. So we're very proud of that, because the teachers do a great job in recognizing early on when a student might be struggling. And that's the key, get them help before it gets to that point of actually planning a suicide.
I would say also, I don't know if you agree, if anything put an exclamation point on that, it was the COVID school shutdown. Then you realize, oh, it's teachers are spending the majority of time with this individual child, more than a parent, more than peers. They actually have the most face time. And when you took that away, we started seeing kids get a little bit lost, and you missed that opportunity. So they were presenting for help, but sometimes much later than they normally would have, because no one was being that person who would spot that little bit of difference or a little bit of check-in or a little bit of change. So our teachers can have a big impact.
Yeah, you said that at the beginning. We had been relying on it because you've seen it working with the behavioral hospitals. We've been working with them since 2001 in some form or fashion. And summer was always the law. It was almost like an accepted thing. But what we found out was there was out of school. The schools were really being our monitor of mental health, not just suicide, but mental health for our kids. And so we were relying on them to, and so the pastors, the parents, the uncles and aunts wasn't used to having to be able to recognize and refer. Then we went to the social distancing and the schools shut down, and we saw a tremendous lack of people there knowing what to do. That's where our parents programs have come in, so important to train parents to be, now let's make sure you're ready to be a frontline monitor also, not just rely upon the school systems. And we can talk about the COVID. I think we're still in for how the impact on mental health is going to be still ahead of us on that.
It is a factor that contributes to kind of what even the American Board of Pediatrics came in early on, that the value of in-person schooling is
Oh, yes.
enormous in children, way beyond just learning to read and write and arithmetic. Like it goes way beyond that in the well-being of children. And that this is just one example, one piece of it, in my opinion.
Yeah, when you saw that the pre-COVID, some of the things we can talk about if we have time, the Youth Risk Behavior Survey was done in 2019, showed some really concerning things where you had over 1 out of 3 identifying that they had felt what we would say the beginning possibly of clinical depression. Uh, Almost 1 out of every 11 had reported at that point that they had actually attempted suicide in the previous 12 months. Now, this is pre-COVID. And this is pre all of those things that we talked about: the social distancing, the not being able to be part of a school, and sports. We've been brought on upon tragically 3 suicides since January, where the parents related it directly to being able not to participate in the sports, and we're talking about 12, 13, 14-year-olds. So how it's going to impact our youth in schools, even though they're starting to get back some with this in and back out and things. I'm really afraid of what it's going to do. I'm not trying to be an alarmist, but I think that the real wave of mental health impact is still coming because we're just getting back in schools, and schools are just now starting to identify some of these mental health issues.
I'd like to clarify with people, as a psychiatrist, I know very well that there is a strong association with depression and anxiety, but there's also a strong association with life changes or stress. And suicide itself exists without those stressors at times and can be something that comes up on its own. It does run in families. It can be the first kind of symptom of anyone having a new onset of depression, et cetera, but it doesn't always. Historically, we would educate family members that if someone had depression, they need to look out for suicide. Your goal, and I think the goal of all of us, should be to recognize suicide as a serious issue and that everyone should be aware of.
Even the CDC says it's a serious public health issue, not mental health, a public health issue.
That's correct.
It's going to be now the second leading cause of death for our young people ages 10 to 24. Actually, when you look at 10 to 44 years old in the nation, it's the second leading cause of death.
After accidents, which, as you know,
Right.
gets combined.
Right.
So yeah, it's a very serious thing. So this is something we're looking at. Everyone has the potential to have an issue with suicide at some point in their life. Clark, can you share some of the things, like some of the top 5 things that are markers that you need to do a little bit deeper digging?
Yeah, I feel embarrassed. I'm talking to our psychiatrist on this, but yeah, I can do that because I think it's important, Dr. Drummond, to say that yes, what we build a lot of our programs on is that there's 2 major studies that have been done, and it both came out with the same. 4 out of 5 people who will be contemplating suicide will show clear warning signs, whether it through emotions or behavioral or physically. So we've got an opportunity to recognize 4 out of 5. Now there's going to be that 1 out of 5 that's going to be that impulsive situation. Of course, one of the big ones we just talked about is depression. Depression goes across all age groups. Depression is a very, very tough one because a person that can be depressed might eat everything that doesn't get out of their way or not eat at all. So, it affects. The hard thing with depression is, it's tough because it doesn't present itself the same way in anything. We always talk about if it's out of character behavior, as you know the person. Does it mean that they're suicidal? No, but it does mean their behavior has got your attention. It's not. It's a really good thing to say, I see this going. I see this behavior. Can we talk about that? Are you having issues? So, depression, very generally speaking, is probably the number 1 across all age groups. Suicide threats. You'd be amazed. Some people say, well, that's just obvious. You'd be amazed how many we've been brought in after a suicide attempt or regretfully a suicide. And the person had communicated to several people, their peers, teachers, pastors, people in parents, where they would say, as obvious as I'm going to kill myself. That could be that. Or have you ever heard a young person say, nobody would miss me if I wasn't around here anymore? Those subtle types of suicide threats, those are a big one. And the previous suicide attempts, I'm trying to stay on some obvious ones. Some people think that that's too obvious, but you'd be amazed at how many times that we've been brought in that it's the second and third attempt that's the tragic one. So we're either under responding or misresponding to those initial ones. that we have an opportunity to get involved. I always say get a professional involved, not because of our affiliations, but because I've been doing this for 24 years. I have a background in that. I wouldn't take a one-on-one counseling situation. I would be part of the team. I'll be there to help stabilize, but you need to get those professional involved. As you said at the beginning, suicide is a very complex issue, and it can sort of show itself in so many different ways. So don't be afraid to bring that professional in.
Attached to this, we're going to have some different ways to get the help, and some different resources that people have access to, so that people will know what to do when it's time for that. And that is something that we always push. A lot of behavior with adolescents is sort of accepted, that they're a teenager or an adolescent, or that's just part of their, growing pains or whatever. But if there's something that you see, ask for help, because adolescents don't always show their emotions very well. Therapy with adolescents is difficult to do. So when you see something, it's time to do something. And that's a lot of what your mission is for parents and for teachers, is to be able to pick that out and say, okay, this is not routine stress or a bad day.
And even if it hadn't got to the point of actually the suicidal ideation, you're doing a great thing. Suicide is usually the result of either an undertreated or underdiagnosed mental health issue that keeps growing. If you can get involved in that, if you can get involved when they're in those early struggle age, then we can make a difference. It's so important when you see those initial signs that somebody is struggling, and you might even ask them, "Are you thinking about suicide?" And they say no. But if you see those things that are disrupting their life, though, that's the best, most successful time of intervention right there.
If I can just make one more comment from working as a psychiatrist, if you're able to communicate about it and talk openly about it and let them know that it does not last forever, people that are having suicidal ideation cannot see that on their own.
Right.
That's one of the first things they need help with. You will get over this.
Right.
You need some time, you need some help, and you need some information. But with that, this will get better. They can't see that. That's the worst thing about suicidal thoughts or ideations, they call it, is that you lose all this, you lose touch with a lot of that, that reassurance and that ability and that endurance. So that's one thing that we use to do that early initial intervention, is to say, okay, you're not the only one to have this feeling. And number two, it will get better.
Right.
Because it will.
Yeah, when you get to that point, that's the utter loss of hope. And you see the world not continuing. And that can be different for a 15-year-old who just lost their girlfriend, who thought that was the one for the rest of their life. We know that there's going to be many more girlfriends after that. But at 15, they haven't had the life experience yet to know that. So they can very well get this tunnel vision of hope where all hope is gone. And so I think, Dr. Drummond, that's very right what you're saying. If we can do anything at all but just to extend that there's hope, there's something that can be done. I might not know what there is. We might not be able to get the school counselor knows, but we'll keep trying. We'll find someone that gives you a solution. If you can get them to buy in on that one, then you can help them.
Yes. Can we talk a little bit about suicide contagion? Because that is a thing.
Right.
What have you seen with regards to that happening in clusters?
Yeah, we have to be careful when we discuss. I think that's something that we saw, especially early on. It's getting better. Early on in the mid the 2004, 5, 6, a lot of schools stayed away from trying to provide education, even for their teachers. Their whole premise was, if we don't talk about it, it won't happen. And I think contagion was a part of that. If we put the idea in their head, then it will spread. I think yes, contagion is real. That is a psychological situation that can happen. I think that what we've seen, though, and I can just talk about our experience, a lot of times when there's contagion, we can go back and see that it sort of came from how a situation where there was a suicide was mishandled, misaddressed by the community, by the school. And so by trying to do something good, a good action, they actually exasperated the situation where somebody that was on the fence, somebody that was maybe at that risk of having suicidal ideation, it tipped them over. So I really think that in our experience, and I can't say clinically, but our experience has been when we've been brought in where there's a contagion situation, so many times we can draw it back to how a previous suicide was handled in the community. And I think that's what we try to tell a school. Not that we have all the answers. We can tell you some of the things not to do, but how they handle it, I think has to be sculptured around each tragedy, regretfully. But, I think it's important how a school responds to it or don't respond to it, can really affect contagion.
Broadly, though, talk more about it, not less about it.
Right. And factually, as you said at the beginning, I think that people are scared to talk about it because they don't understand anything. If I asked you today, you're a clinical psychologist, a psychiatrist. If I asked you to talk about the atomic reaction, you wouldn't feel comfortable. Maybe you should, but that because you don't know about it, and we're uncomfortable talking about something we don't know. That's why it's awfully important, like we're doing here today, to educate the public, to educate people, not to be doctors or counselors, but to give them a base understanding so that fear goes away, that fear of talking about it openly and very professionally to a young person. That sort of gives them a sense that if I'm willing to talk about it openly and confidently, then hey, yeah, this guy or this woman, this person knows about it. I can listen to them and I can get guidance from them. So education and feeling comfortable about speaking, but you can only do that when you learn about it.
Do you have a story that sticks out in your mind that you can share about a success that's come about because of the Jason Foundation in particular, or some of that
One
education?
one that goes on both sides. I think that so many times we've seen that types of school violence and things was can be tied to this type of suicidal ideation, or like you say, the person that did the shootings in these schools were actually suicidal people who took that out on who they thought was the cause first, with the intention of not living through it. But we had one, I won't say what part of the country because you go all over the place, that we had where a young person had actually gone through our student curriculum, and they came back. It had been some time, and they went to the teacher and said, "I'm worried about so and so. I think that because I went through this program, and there's a lot of we don't have the only good one. Let me say that, but." They had gone through it and they had felt comfortable enough to say that I've talked to my friend, but they're saying nothing's wrong. But I think there is. Well, the teacher dismissed it, and the student wouldn't give it up, went on to the counselor and told the counselor, and still bugged the counselor so much in a 1 day period that the counselor said, "We'll bring the person in." They brought the person in, and while they brought the person in, it was just procedure. They sent one of the people in administration to the locker. When they opened the locker, the young person had a list in it of people that they had planned, and a weapon that they had planned to use and take these people out. And in the process where they were getting that out, the young person had talked to the counselor and said, "Yes, I am thinking about killing myself, but I want to do something else first." And so by this young person learning the warning signs, learning to be very confident with their friend and saying, "Hey, I'm worried about you," but not taking that friend's response, "There's nothing wrong, don't bother me about this," to the point where they not only went to the teacher, who didn't respond regretfully in the positive way, took it on to the counseling department at their school, insisting that something. We probably, in that one situation, possibly saved some young people's lives, some teachers, administrators' lives, and that young person's life itself. It's not, as they say, right, just learning those warning signs and getting somebody to take action. I think that's the best example of not only saving that young person's life, but also possibly saving others people's lives where that anger was going to be turned outward first.
That's great. That bit of education to students about other students, to me, is very important.
Right.
Um, it's not a hero act. Suicide's not a hero act. It's not romantic. It's not a way to get your point made. And it's really going to be something that impacts many people for the rest of your life. And it's something to be dealt with. And there is a cure for it.
Right. And a lot of times young people, they'll get to the point where they think that's the good answer. I'm really saving a lot of people from pain. This is the best answer for me to remove myself. I think for a friend, for a parent, for a teacher to be able to see somebody in that spot and reaffirm that person's value to you, reaffirm that person's worth to the community and how you're caring about them could actually save the life without doing anything but saying, "I see that you're hurting and I'm here for you." Because I still get back to that utter spot of hopelessness and despair is when suicide really becomes a danger.
And I think that reaching out and expressing gratitude towards relationships, people in your life, people
Yes.
around you, I hope we've all learned that during the COVID how important that is across the board. And it definitely applies to youth at risk. What would you like to see, if you had a magic wand, be different about the way that our perception or attitude towards suicide is?
First, as we've talked to things, to be able to have a more positive, ongoing conversation about it, to be able to make it part of a teacher's training, but not something that's just something to check off a box. I mean, and then to take that further, we can't just keep. I think COVID showed that we can't just keep relying upon our schools to be our monitor for public health, mental health for our kids. We've got to bring the pastors in. We've got to bring the community leaders, not just the parents. We got to get the uncles and the aunts and the grandparents. We have to get all of these people involved. Not only is it going to help the young people, as we said, second leading cause of death all the way up to age 44. I mean, it's going to help those that are out there that are still the young people that middle age that's out there. So if I could change the mindset of the community of saying that we have to talk about this as a public health issue, and we have to do it in a very confident, and we have to do it in a very open way, instead of, as I've even seen some professionals in the town say, we're going to talk about the S word. We wouldn't even say the word suicide. We have to be able to talk about it like we do drugs, alcohol, even bullying now. Make it a subject that it's a proactive action rather than we're just reacting to a tragedy.
One of my lines has always been, it's normal to have thoughts of suicide. It's not normal to act on it.
Right.
So it's time to examine these thoughts and see what needs to be different in your life.
Right. Yes. It's got to be a thing where, especially if they're reaching out, and it can be subtle. Like I said, nobody would miss me if I'm here. Nobody cares about me. You're not going to have me around much longer. In other words, those are things that should get our antenna up and get us to say, what did you just say? Do you know how my world would be without you in it? I mean, I tell them, I say, I don't care if your son's a 6'5", 285-pound tackle. Go up and hug them and tell them every day how much you love them, how much you care about them. I think that that's something that we assume. Us guys get in that trouble because we don't tell our wife. We assume they know we love them or something. But to be able to affirm that, and I think that's the same thing we have to do with as our friends, our peers, as parents, as teachers, being able to express that you're of value to me and I appreciate your friendship. I appreciate you being here. I think we have to do more of that. It would help the world.
Absolutely. And I know just, you started with a lot of people reaching out from sports teams that had some tragic things happen, and they weren't really good about talking about feelings or talking to players. I know you've had some specific work you've done in that area that you've really had an impact in the ability to process through
Well, they've
that
come a
issue.
long way. It used to be in not too a couple of decades ago. It was a suck it up, don't show weakness. You've got to be tough. You can play through it. Now I have to say, and I know we work a lot with coaches, and Coach Fulmer was doing an interview I was with lately, and he was saying, the schools have come, especially the universities, have come a long way. I think in the last decade, they were recognizing that mental health of an athlete is just as important as the physical health, because if they're not mentally healthy, if they're not on 100%, it affects their performance. And so even if it's a little selfishness, I want good performance out of this athlete, so we have to have good mental health. The end result is good still. We're trying to make sure that student athlete has a good basis of mental health, and if they don't, we want to give them the help. So I have to take my hat off to a lot of colleges across the country who are really making a big effort. We need to get that into high schools and middle schools and even elementary schools. Right now, most people I talk to don't know. 10 to 14-year-olds used to not even register in the data. Now it's the second leading cause of death for that small segment of 10 to 14-year-olds nationally. So that's just showing you what's happening in our society now with those pressures on mental health. And that's in 2019 was the last report. So I really think that when we come out in 2022 with some new data based on 21 and 20, I'm afraid it's not going to be a really an encouraging data.
We're going to start to see more and more, but I hope we'll get some helpful insights. My hat's off to you and your team for all the lives that you've touched.
It's a
So
team effort. We couldn't do it without you guys. I mean, that's who the Jason Foundation is. It's our affiliates, our people who are helping us get that information to the local community. It doesn't need to be a corporate thing where we're in Nashville, Tennessee, and we're helping somebody in Houston, Texas. It's got to be Houston, Texas people that we empower to help Houston, Texas people. So that's why our affiliations are so important.
absolutely. So this is Suicide Awareness Month. That's one of the drivers for us having this talk. But every day should be Suicide Awareness Day, and it's okay to talk about it, and it's okay to reach out and to look for help. We're going to have associated with this National Suicide Hotlines and some local resources for people to reach out to. And like you said, everyone should have a pretty low threshold, particularly with one of their kids. If it even crosses their mind that they might need some help, I think that's a sign that they should probably call and at least have an evaluation or just get somebody to talk with them about it. Don't hold back and don't wait for the worst, you know. That is a real issue.
Yeah, that's what we do in our parent team. And just exactly what you say, Dr. Drummond. We tell people we've gone through, usually our parent seminar is an hour long, hour and 15 minutes long. We've gone through this. We've talked about warning signs. We've got in detail. But I always, when I'm involved with it, I end it with the same thing. Let's go by your gut. If you feel something's not right with your son or daughter, your grandson or granddaughter, you're dealing with the kids in a Sunday school class or on a sports team, if in your gut there's just not, you can't say, well, that's number 4 on the warning signs, that's number 3 on the, throw that out the window. In your gut, if you feel like there's something not right, follow that. You can't ever go wrong by doing that. Even if the person is not struggling with some mental health issues or suicidal thoughts, you've affirmed to that person that you care. And that's not a bad thing. No matter, we all like somebody stopping us in our world and saying, you matter to us. And you matter because I'm asking these questions. So it's a win-win.
Absolutely. Thank you for your time today. We're going to leave it at that because I think that's the take home, honestly, the message. And I appreciate all that you do. And thank you for your time. And everyone can reach out through the resources associated with this podcast if they have an issue or other questions.
Good deal. Thank you for having and appreciate working with you guys.
All right. Same here.